Are you getting ready for the OET Speaking Test? Today, I'm answering some of the most frequently asked questions about the OET Speaking Role play. Let's dive right in. First question, how should I start the role play? Always begin by greeting the patient and introducing yourself. Keep it professional, but remember, this is a conversation, not a script. Second question, what if I don't know the medical term? Don't panic. Use simpler language to explain what you mean, as if you're talking to a real patient. Third question, how can I manage my time? Keep track of time during the role play. Focus on the patient's concerns and avoid getting lost in details. Now here are my top tips. Tip 1, practice active listening. Pay attention to the patient's cues and respond naturally. Tip 2, practice fluency, not perfection. You don't need perfect grammar, but you do need to communicate clearly. Tip 3, stay calm. Nervous? Take a deep breath before starting. It'll help you focus. If you follow these tips, you'll feel confident in your OET speaking role play. And if you need more support or free OET classes, feel free to reach out to me at +6 14684808877 on WhatsApp. I'm here to help. Good luck, and don't forget to subscribe for more OET tips.